Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Damodhar Garu, who is an MD in internal medicine. For today's show, we talked that we will be speaking about lung failures. So today, Damodhar Garu, today we decided we'll cover a little bit about the respiratory system, which is one of the most important systems in the human body. So without any further delay, let us welcome Damodhar Garu onto our show. Doctor, welcome back. How are you?
Hi, Shivani. Thank you for having me back. All good, all good. And since we, finished the cardiac emergencies, the most other system is pulmonary system. So we'll go into those emergencies, and you know, then we'll move on with other systems. So
Yes.
pulmonary, like we discussed, anatomy of the heart. I would like to, you know, go through the anatomy a little bit, you know, about the lungs. So left lung is a little smaller because it has to adjust the heart, because the heart is on the left side, right? Right lung is a little larger. So so basically 55% of the function is by right lung, and 45% is through the left lung. Okay. When I say function, it is the lung function is like ventilation and perfusion, right? So when you take breathe in, then the oxygen level goes into the lungs, and ventilation. That's called ventilation. And perfusion is the pulmonary artery supplies the blood circulation. So that air, has to that oxygen has to be absorbed in the lungs, and so that it carries to every organ and cell in the body so that they get oxygenation. It's like life. And when the oxygenation is stopped, the life is gone. So it's very important. So since the right lung is big, it does 55% of ventilation and perfusion, and left lung 45%, right? So that's important thing. And each lung is divided into segments and lobes. And so the left lung is divided into upper and lower lobes. The right lung is divided into three: right, middle, and lower lobes. And these lungs, and they are covered by surface layer, like heart. We said pericardial, cover, pericardial membrane. So this has a visceral layer and parietal layer. So there is a space, small space between those layers, two layers, and that's where the fluid, the lubricant, so a little bit of fluid to make the expansion easy. Like our like when you do bikes and cars, they have those systems. So obviously, why I'm telling you is because when the layers get accumulated with fluid, it's called pleural effusion. That means there is a fluid accumulated between the visceral and parietal membrane, and when the fluid accumulates, it compresses the lungs. And we'll come to that topic in next time. That's called pleural effusion. And why it happens is because of the pulmonary hypertension, especially systemic venous hypertension. They call venous hypertension, right? So this is the basic anatomy, Andy. If you have any questions, shoot before we go into the most important topic, where even in America till today is advanced technology. 100,000 people die every year with acute pulmonary embolism. That means you can imagine in India, obviously a lot of deaths are not properly, investigated, and cause of death is not known, right? because unless you do autopsy, you don't know what's the cause of death. It's very high in other countries. Okay.
My question would be, what are the basic, what do you say, what are the most common pulmonary diseases that people first get diagnosed with, and can you just basically break down the statistics for the viewers watching if you can?
Sure, yeah, of course. See, pulmonary is one of the most common after heart. You know, people visiting like doctors is one of the common reasons because respiratory infection, like the COVID era, it's all about most of the time lungs, right? So COVID, basically coronavirus, it affected the lungs and caused so many complications with the lungs, and they have to go on ventilators and intubation and artificial support. So we'll all discuss about that. But the most disabling condition in the world is COPD, and the COPD అంటే chronic obstructive pulmonary disease, which is a big problem all over the world because it's most disabling also. People end up on oxygen and they cannot even walk. They have to carry oxygen tanks wherever they go. But we'll come to that topic later. But today I would like to focus on the emergencies like we did in cardiac side. One of the most common emergency, like I said, is acute pulmonary embolism. You know, which is let me simplify it to the general population that the pulmonary artery kind of supplies both lungs where it requires perfusion. I mean, like ventilation perfusion, where oxygen has to be transported to other parts of the body and all over the system. So when it gets obstructed, not just pulmonary artery only, it can be any of the small branches it can obstruct. That's called acute pulmonary embolism. And to classify it, you can classify it as it acute or subacute. Okay, and you can classify it as stable or unstable, right? And there is also location wise. So the obstruction can be segmental or lobar or saddle. Saddle means it's real emergency, like they can die within 2 hours. Okay, unless you intervene. Okay. So symptoms, if you go to symptoms, the most common symptoms is shortness of breath. most of that. తర్వాత చెస్ట్ పెయిన్ వస్తుంది. ఆ చెస్ట్ పెయిన్ కూడా జనరల్ పాపులేషన్ కి డిఫరెన్షియేట్ ఏంటంటే ఇప్పుడు మనం హార్ట్ అటాక్ లో కూడా చెస్ట్ పెయిన్ వస్తుంది, దీనికి కూడా చెస్ట్ పెయిన్ వస్తుంది. హార్ట్ అటాక్ లో కూడా మస్తు వస్తుంది, దీనిలో కూడా మస్తు వస్తుంది. దీనికి దానికి ఏంటంటే ఇక్కడ అక్కడేమో నువ్వు ఏను కూర్చున్నట్టు ఉంటుంది చెస్ట్ పెయిన్ వచ్చినప్పుడు. ఇక్కడ ఏమైందంటే ఇట్లా బ్రీతింగ్ తీసుకున్నారా అప్పుడు పెయిన్ ఎక్కువ అవుతుంది. సో అట్లా అన్నట్టు. సో తర్వాత ఏమైందంటే ఇఫ్ ఇట్ ఈస్ రియలీ బ్యాడ్ పీక్ అబ్స్ట్రక్షన్, బ్లడ్ ప్రెషర్ సడన్ గా డ్రాప్ అవుతుందండి. లైక్ దే కెన్ గో ఇంటు సడన్ షాక్ ఆల్సో, especially if the blood pressure drops to 90. And sometimes it can be like, let's say మీ బ్లడ్ ప్రెషర్ 130 నడుస్తుంది అనుకోండి, 40 యూనిట్స్ తక్కువ పడ్డది అనుకోండి, like it's one of those you start having symptoms. And if you don't intervene within 2 hours, you can die, right? And when you go into the etiology and actually statistics లో అనుకోండి, like I always focus on the statistics. Women actually less అండి, males more incidents. Okay, and like I said, it's almost like 100K every year in America. Just the deaths, 100,000 people die in America just with pulmonary embolism in America, which is supposed to be, most advanced country, right? And then when we go to the etiology, it can be, మీరు ఆల్వేస్ అంటారు కదా, యంగ్ పీపుల్ ఎందుకు వస్తుందండి అని అంటారు కదా, అది హెరిడిటరీ. ఓకే, so it can be due to hereditary and it can be due to acquired. Okay, so basically hereditary causes లా నేను ఆల్వేస్ చెప్పినా కదా మీకు ఇంతమంది కూడా, లైక్ కోవిడ్ వచ్చినప్పుడు చాలా మంది, కొంతమంది చచ్చిపోతున్నారు, కొంతమంది ఎందుకు చచ్చిపోతలేరు అని మీరు అడిగి చూడండి క్వశ్చన్. ఇప్పుడు ఈ క్లాట్స్ రాని కూడా మీరు హెల్తీ ఫిట్ ఉన్నా అని మీకు ఈ క్లాట్స్ రావచ్చు, పల్మోనరీ ఎంబోలిజం రావచ్చు, సడన్ గా చచ్చిపోవచ్చు. ఎందుకంటే there's some hereditary reasons అండి. The common things for general public is like you have to focus, especially if somebody has usually the clot happens in the legs అండి, most commonly. We call it as deep venous thrombosis. When the clot happens in the leg, then the clot breaks and then it goes and gets stuck in the lungs, right? So that's called pulmonary embolism. So usually, most of the time, the clots happen in the legs, called DVT, deep venous thrombosis, and when they get dislodged, they go and stuck in the lung, and they cause, when the pulmonary artery or its branch is stuck, then what happens? The oxygenation level will go down because you're breathing, but the air has to go and mix with blood to get, oxygenation, right? That will come when we go to hematology topic. I'll explain that also. So when that goes down, then you get hypoxic because like it's like choking. Somebody is choking. Like you're not getting enough oxygen in your system. So that's what happens, Anato. So the most common cause is deep venous thrombosis of the legs. But again, the thrombus can happen in the pelvic vein, pelvis, right? Pelvis is like below the abdomen. And also the clots can happen above pelvis, they can happen in the arms. The most common is legs. Okay, so when we go to the acquired causes, there's a lot of acquired causes. Like, flight లలో పోతే భయపడతారు చూడు. One of the reason for people who develop clots is flights. ఫ్లైట్స్ లో ఏమవుతుంది, మీరు కూర్చుంటారు లైక్ లైక్ ఇట్స్ లైక్ లెట్స్ అమెరికా నుంచి రావాలంటే 18 hours ఫ్లైట్ కదా. సో ఏమవుతుందంటే అక్కడ మీకు బ్లడ్ ఫ్లో అనేది, సర్క్యులేషన్ స్టాగ్నెంట్ కాదు కానీ లైక్ ఇట్స్ నాట్ లైక్ యాక్టివ్. So people who are prone to clots, they can develop clots when you are sitting for a long duration of time. అందుకే నేను చెప్పాను, ఈ టీవీలు చూసుడు, ఇమ్మొబిలిటీ ఉన్న వాళ్ళకి హార్ట్ ప్రాబ్లం కాదు, క్లాట్స్ కూడా వస్తాయి లెగ్స్ లో. అందుకే ఇప్పుడు మీరు చూసారు కదా, హాస్పిటల్ పోతే జనరల్ గా సర్జరీస్ అయినాక వాళ్ళకి అది స్టాకింగ్స్ వేస్తారు, కంప్రెషన్ స్టాకింగ్స్ అంటారు, తర్వాత ఎస్సిడీస్ అంటారు. సో అవి ఏంటంటే కాన్స్టెంట్ గా ప్రెషర్ రిలీజ్ పంప్ చేస్తుంటాయి, సో దట్ ద సర్క్యులేషన్ గోస్ వితౌట్ ఇంటరప్షన్. ఎస్పెషల్లీ హిప్ సర్జరీ, knee replacement, hip replacement, those patients are very highly prone for DVT. And when DVT happens, then the next thing is if the clot dislodges, it goes and stuck in the lungs and it causes acute pulmonary embolism. And all these symptoms start. So the other causes, there are so many other causes. is like smoking is one of the risk factors. Okay, and then trauma. But young people, sports ఆడతారు కదా, sports injuries లో కూడా it can damage the endothelium, then they can develop clot. Any injury, it can precipitate, platelets ఏమైతే accumulate అయితే clot అవుతుంది. So the mechanism is like when you get a cut, the platelets have to form a clot to stop the bleeding, right? And when it happens in the blood vessel, the clot happens to protect you, but if it displaces, then it has to go somewhere and get stuck, right? The only way it can stuck is lungs. So that's what happens on that too. Tarvata, there are so many other things. Like the most important thing I want to discuss is cancer patients are very risk of clots, and they can die in sleep because of the clots and pulmonary embolism. Because క్యాన్సర్ అయినప్పుడు ఏమవుతుందంటే బ్లడ్ లో ప్రోకోఆగులెంట్ సీక్రెట్ అవుతుంది, అది స్టిక్కీ, బ్లడ్ స్టిక్కీ అయింది అనుకోండి, క్లాట్ ఫామ్ అవుతుంది. అదే కదండి ఇప్పుడు మనం జనరల్ గా ఇప్పుడు నల్ల అంటాం చూడండి, మనం తిన్నప్పుడు ఎట్లా స్టిక్ అవుతుంది. సో ఇట్ గెట్స్ క్లాట్, వన్స్ ఇట్ క్లాట్స్ ద సర్క్యులేషన్ స్టాప్స్. సో దాన్ని అంటే ఫర్ మెడికల్ పీపుల్ దెర్ ఇస్ ఏ టర్మ్ కాల్డ్ విర్చో ట్రయాడ్, VIRCHO, విర్చో ట్రయాడ్. ఇట్స్ నథింగ్ బట్ the flow obstruction or the vessel injury, or there is a hypercoagulation stuff. These three can cause that. And then the another important thing ఏంటంటే బ్లడ్ గ్రూప్లలో కూడా కొంతమందికి ఎక్కువ ఇన్సిడెంట్ క్లాట్స్ ఉంటాయి, కొంతమంది తక్కువ ఇన్సిడెంట్స్ ఉంటాయి. అయితే ఓ గ్రూప్ ఈజ్ మోర్, ఐ మీన్ లైక్ ఐ డోంట్ నో విచ్ గ్రూప్ యు ఆర్, బట్ ఓ గ్రూప్ బ్లడ్ గ్రూప్ వాళ్ళకి కొంచెం లెస్ రిస్క్ అండి thrombosis. And again, like the most important thing for people like you is contraception pills. Oral contraceptive తీసుకున్న వాళ్ళకు కూడా క్లాట్స్ రిస్క్ ఎక్కువ ఉంటుంది. తర్వాత స్టిరాయిడ్స్ తీసుకుంటారు కదా, స్టిరాయిడ్స్ తీసుకున్న వాళ్ళకు కూడా క్లాట్స్ ఎక్కువ వస్తుంది. తర్వాత బ్రెస్ట్ క్యాన్సర్ ఉన్న వాళ్ళు టామాక్సిన్ మీద ఉంటారు కదా, సో వాళ్ళకు కూడా క్యాన్సర్ రిస్క్ ఉంటుంది. అంటే మెడికేషన్ కెన్ ఆల్సో ట్రిగర్ క్లాట్ ఫార్మేషన్.
Heart diseases and lung diseases can kind of feel the same, but they aren't actually super similar. So, can you maybe tell us what are some daily rituals or daily, things that we can incorporate for a healthy respiratory system?
The most important thing is avoid smoking. Smoking is one of the most common cause of all the lung problems, right? Of course, it affects all the systems, but it directly goes and deposits in the lungs. And all this, when you inhale all that stuff. Plus, early morning, oxygenation and fresh air. Pollution is a problem. Like, if you look at the Delhi now, what's happening? So pollution is another important thing, and occupation is very important also. Asbestosis under some of the shipping industries and where people work, they have to really be careful, occupational hazard and stuff like that. And another thing is vital capacity. And to increase the vital capacity, you have to do the exercises. There's so many exercises. So the most important thing is clean air. Unfortunately, there's so much pollution happening all over the world, which we have less control, but hopefully one day everybody will chip in and environment, will get better, because, so much industrialization and cutting all these trees. You know what I mean? So, obviously the trees are important because they take carbon dioxide and give you more oxygen, So environmental control is one of the important things. And of course, your personal hygiene is very important too, right? Like, avoiding all those medications and, the toxins which can affect your lungs and cause injury to the alveoli.
And also,
Say,
maybe can you tell us some healthy foods? I think the viewers can be a little bit more, invested if they get to know that there any specific food or, some habits again.
right. So food-wise, I don't think there's a whole lot of foods which are focused towards the lungs. But again, it's all about the healthy diet, you know. But the breathing exercises can help. You know, some of these yoga exercises. I think there is no, like concrete data, but I'm sure all this. Like personally, I do Aloma, Viloma, and Kapala Betu and all that stuff, and you know. So most of those breathing exercises, I think, will help you to kind of expand your lungs and help kind of especially when the sinuses gets cleared because the respiratory system starts from your nose, right? It's kind of so you got to start you know doing that. But diet wise, I think healthy diet is always good, but I don't think there is any particular diet which is going to focus and help your lungs. As far as I know. Air condition all the time nowadays. In the cars, air condition, at home, air condition. So try to use the best equipment and get the filters changed, very frequently according to the like, required, you know, standards. And I mean, like personally, for me, car is important for me and house is important for me because these are the two places I spend most of the time. So I don't mind spending more money. పైసలు ఎక్కువ ఖర్చు పెట్టడంలో నాకు బాధ ఉండదు ఎందుకంటే ఇంట్లో ఉంటాము కార్లో ఉంటాము ఇదే రెండు ప్లేసులల్లో మంచిగా పెట్టుకోవాలండి మీకు ఎన్ని పైసలు ఉన్నా ఏం ఫాయిదా లేకపోతే ఇంట్లో వస్తే మీకు క్లీన్ గా ఎయిర్ కండిషన్ ఇట్ హ్యాస్ టు బి రియల్లీ రియల్లీ గుడ్ కార్ ఎక్కినావు ఎయిర్ కండిషన్ కూడా రియల్లీ గుడ్ ఎస్పెషల్లీ ఇన్ ఇండియా ఏముంటదండి లేకపోతే ఆ పొల్యూషన్ మీకు ఎన్ని పైసలు ఉన్నా కానీ రోడ్డు మీద ఎక్కిందంటే యు ఆర్ అగైన్ లైక్ ఎనీబడి ఎల్స్ రైట్ సో ఇఫ్ యూ హ్యావ్ ఎ బెటర్ కార్ విత్ బెటర్ వెంటిలేషన్ it will help your lungs, right? So because I think that's important, like changing the filters and having efficient air conditioning system, and humidity maintenance for rich people, but for poor people, God has helped them with the nature, especially people in villages. They already have their, five-star air condition because when they get out of the home, they're already getting the fresh air without any pollution, right? Like in the city, you need all this. But when you go to village, God gave them like so many trees and, they just don't have to worry about anything. They'll keep the doors open, like, because I grew up in a village and my home doors were always open. My ఇంటి తలుపులు ఎప్పుడు ఓపెన్ ఉంటాయి అన్న never closed. So it's fully ventilated. People come, go, but it's a trust, So అది అంటే there is always we don't want to divert the topic, but let's get back to the pulmonary embolism. There is a well score అని ఉందండి. The well score ప్రకారం more than 6 ఉంటే very high probability of clot. So again, treatment, when we go to treatment, obviously the most important treatment is when you have life-threatening emergency, you need an intervention, right? Either they have to go directly to the cath lab, not cath lab, sorry, OR, and get embolectomy. So they can remove the embolus by intervention, or they could do a thrombolysis. That means హార్ట్కే కాకుండా హార్ట్లు ఇస్తాం కదా ఇప్పుడు క్లాట్ బస్టర్ అంటారు కదా ఇక్కడ కూడా మనం వీ కెన్ గివ్ ఏ క్లాట్ బస్టర్ టు బ్రేక్ దట్ థ్రాంబస్ so that when you break the thrombus, the circulation starts going, and then they start getting oxygen, and it circulates. So, but the standard treatment is anticoagulation. Anticoagulation in the sense making the blood thinner, right? We discussed about this so many times with the heart. There is coumadin, warfarin, where you have to monitor INR, and the newer, anticoagulants are always encouraged or perfect, like, they are coming in India also. They called direct oral, anticoagulants, DOAC, and so they are very good. They are expensive, but you don't have to worry about testing blood and seeing, and they don't have to stay in the hospital to monitor. They can go home on them. So it is actually efficient for the government, for the hospitals, because they can be discharged next day itself. On the, there's so many of them. I can name them. There's like we already named them: Geralto, Rivaroxaban, Apixaban, which is called Eliquis, and there is Edoxaban, all those direct DOAC they call. They are much
Yeah.
better than coumadin or warfarin, right?
Doctor,
Yeah,
I
one
think we
point.
can get in deep with these kind of what kind of different testings are available, and and more in detail maybe in the next episode, because it's a time constructed episode. I think we can get on with it again in the next week. Thank you again, Doctor, for tuning in. It was lovely having you as usual. Thank you again for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.